Introduction to art therapy. Art therapy is a distinct mental health profession that uses the creative process of art making to improve and enhance the physical, mental, and emotional well-being of individuals. It is based on the belief that the creative process involved in artistic self-expression helps people to resolve conflicts, develop interpersonal skills, manage behavior, reduce stress, increase self-esteem and self-awareness, and achieve insight. This therapeutic approach integrates psychological theories with art practices, offering a unique pathway to healing and self-discovery. It is not merely about creating aesthetically pleasing art, but rather about the therapeutic journey and the insights gained through the process. The field of art therapy emerged in the mid-20th century, drawing from influences in art education, psychiatry, and psychotherapy. Early pioneers recognized the profound psychological benefits of engaging in art, particularly for individuals who struggled with verbal expression. Over decades, it has evolved into a recognized and regulated profession, with established theoretical frameworks and evidence-based practices. Its history reflects a growing understanding of the mind-body connection and the power of nonverbal communication in therapeutic contexts. Core principles and benefits. At the heart of art therapy lies the principle that the creative process itself is inherently healing and life-enhancing. It provides a non-verbal outlet for emotions, thoughts, and experiences that may be difficult to articulate verbally. The act of making art can externalize internal struggles, allowing for a safe distance from which to observe and process them. This externalization fosters self-reflection and insight, enabling individuals to gain new perspectives on their challenges. The focus is on the process of creation, not the aesthetic outcome, emphasizing personal meaning and therapeutic discovery. The benefits of engaging in art therapy are extensive and multifaceted, impacting individuals across various dimensions of their well-being. Art therapy can significantly reduce stress and anxiety, offering a calming and meditative experience. It enhances emotional regulation skills by providing a constructive way to express and understand feelings. Furthermore, it boosts self-esteem and confidence as individuals create tangible representations of their inner world and overcome creative blocks. The process also improves problem-solving abilities and communication skills, especially for those with limited verbal capacity, by offering alternative modes of expression and exploration. Theoretical foundations. Psychodynamic approaches. Psychodynamic art therapy draws heavily from Freudian and Jungian theories, emphasizing the unconscious mind and its influence on behavior and emotional states. This approach posits that art making can bring unconscious material to conscious awareness, allowing individuals to explore repressed memories, desires, and conflicts. The symbolic nature of art is crucial here, as images created can represent inner experiences that are otherwise inaccessible. Therapists using this approach often analyze the content, process, and symbolism of the artwork to gain insight into the client's psychological landscape. The therapeutic relationship is also central, providing a safe space for exploration and interpretation. Key concepts in psychodynamic art therapy include transference, countertransference, and the interpretation of symbols. Transference refers to the client's unconscious redirection of feelings from a significant person in their past onto the therapist, which can be expressed through their art. Countertransference is the therapist's emotional reaction to the client, also potentially influenced by their own unconscious. Interpreting symbols in artwork involves understanding the personal and universal meanings embedded in the images, helping clients to make sense of their internal world. This process facilitates emotional release and promotes deeper self-understanding, leading to lasting psychological change. Theoretical foundations. Humanistic approaches. Humanistic art therapy is rooted in the philosophies of Carl Rogers and Abraham Maslow, emphasizing the individual's inherent capacity for self-actualization and personal growth. This approach focuses on the client's subjective experience, promoting self-discovery, autonomy, and the realization of one's full potential. The therapist acts as a facilitator, providing a supportive, non-judgmental environment where clients can freely explore their inner world through art. The emphasis is on the present moment and the client's unique journey, rather than on past traumas or unconscious conflicts. It values empathy, unconditional positive regard, and congruence in the therapeutic relationship. The core tenets of humanistic art therapy include client-centeredness, self-expression, and the belief in the individual's innate drive towards growth. Clients are encouraged to choose their own art materials and themes, empowering them in their creative process. The artwork is seen as a direct reflection of the client's current emotional state and their path towards self-understanding. Through art, individuals can explore their identity, values, and aspirations, fostering a deeper connection with their authentic self. This approach helps clients to build self-esteem, develop a stronger sense of self, and ultimately achieve greater personal fulfillment. Cognitive behavioral and Gestalt art therapy. Cognitive behavioral art therapy, CBAT, integrates principles from cognitive behavioral therapy, CBT, with art making to address dysfunctional thoughts, feelings, and behaviors. This approach helps clients identify and challenge negative thought patterns and core beliefs through creative expression. Art activities are used to visualize cognitive distortions, explore alternative perspectives, and practice new coping strategies. For example, a client might draw their anxiety-provoking thoughts, then redraw them in a more realistic or positive light. CBAT is highly structured and goal-oriented, focusing on concrete changes in thinking and behavior. It empowers clients to actively participate in their therapeutic process by creating tangible representations of their progress. Gestalt art therapy, inspired by Gestalt psychology, emphasizes holistic awareness and the integration of mind, body, and emotions in the present moment. It encourages clients to explore their artwork as an extension of themselves, engaging in a dialogue with their creations. Clients might be asked to become a part of their artwork and express what it feels, thinks, or needs. This process helps individuals to complete unfinished business, resolve internal conflicts, and achieve greater self-awareness and integration. The focus is on direct experience and personal responsibility, fostering a deeper connection to one's authentic self. It encourages clients to fully experience and express their emotions through art. Developmental and systemic theories. Developmental art therapy integrates theories of human development with art making, understanding that individuals progress through predictable stages, and art can reflect and facilitate this journey. This approach considers the client's age, cognitive abilities, and emotional maturity when selecting art materials and interventions. For children, art can be a primary mode of communication, revealing their developmental stage and emotional needs. For adults, it can help revisit unresolved issues from earlier life stages or navigate current developmental challenges. The artwork serves as a window into the client's developmental world, offering insights into their growth and areas needing support. Family systems art therapy applies systemic principles to art making, viewing the individual within the context of their family or social system. This approach recognizes that an individual's issues are often intertwined with family dynamics and patterns of interaction. Art activities are used with families or groups to explore relationships, communication styles, roles, and boundaries. For example, family members might create a collaborative artwork representing their family structure or individual drawings depicting their place within the family. The shared creative process can reveal unspoken tensions, foster empathy, and facilitate new ways of relating, promoting healthier family functioning and communication. Art materials and their properties. Understanding the properties of various art materials is fundamental in art therapy, as each medium offers unique expressive qualities and therapeutic benefits. Dry media, like pencils, pastels, and charcoal, provide control and precision, often appealing to clients who prefer structure or are hesitant to express strong emotions. Wet media, such as watercolors and acrylics, are more fluid and spontaneous, encouraging emotional release and exploration of ambiguity. Clay and other sculptural materials offer a tactile, three-dimensional experience, allowing for grounding, containment, and the physical manifestation of internal states. The choice of material can significantly influence the client's engagement and the therapeutic process. Beyond their physical properties, art materials also carry symbolic meanings that can be explored in therapy. For instance, the permanence of ink might represent commitment or irreversible decisions, while the ephemeral nature of sand or water could symbolize change and impermanence. The resistance of stone or wood might reflect feelings of stubbornness or resilience, whereas the malleability of clay can signify adaptability and transformation. Therapists consider these symbolic associations alongside the client's personal interpretations to deepen insights. The interaction with the material itself can become a metaphor for life experiences, offering rich ground for therapeutic dialogue and self-discovery. Assessment in art therapy. Assessment in art therapy is a crucial process used to gather information about a client's emotional, cognitive, and social functioning through their engagement with art. It helps therapists understand the client's strengths, challenges, and therapeutic needs, informing treatment planning and intervention strategies. Unlike traditional verbal assessments, art-based assessments offer a non-threatening way for clients to express themselves, particularly those who struggle with verbal communication or have experienced trauma. The assessment process considers not only the final artwork, but also the client's process of creation, their choice of materials, and their verbal responses to their art. This holistic approach provides a rich, multi-dimensional understanding of the individual. Several standardized and non-standardized art-based assessment tools are utilized in art therapy practice. Examples include the Kinetic Family Drawing, KFD, which asks clients to draw their family doing something, revealing family dynamics and roles. The House Tree Person, HTP test, invites clients to draw these three elements, providing insights into self-perception, environmental relationships, and unconscious aspects of personality. The Diagnostic Drawing Series, DDS, involves a sequence of specific drawing tasks designed to elicit diagnostic information. These tools, when used by trained art therapists, offer valuable diagnostic and therapeutic insights, complementing verbal assessments and providing a unique window into the client's inner world. They are interpreted within the context of the client's history and current situation. Therapeutic techniques. Drawing. Drawing is one of the most fundamental and versatile therapeutic techniques in art therapy, offering a direct and immediate way to express thoughts and feelings. From simple scribbles to detailed illustrations, drawing allows clients to externalize their internal world, providing a tangible representation of their experiences. Techniques include free drawing, where clients draw whatever comes to mind, and directed drawing, where specific prompts are given, such as draw your feelings or draw a safe place. The choice of drawing material, pencil, charcoal, pastels, also influences the expressive quality, offering varying degrees of control and intensity. This accessibility makes drawing suitable for clients of all ages and artistic abilities, fostering self-expression and insight. Interpreting drawings in art therapy involves a multi-layered approach, considering both universal symbols and the client's personal associations. Therapists observe elements such as line quality, e.g. strong, hesitant, broken, use of space, e.g. crowded, empty, color choices, and the overall composition. They also explore the client's narrative about their artwork, asking open-ended questions like "Tell me about your drawing" or "What does this part represent to you?" This collaborative interpretation helps clients gain insight into their emotions, conflicts, and coping mechanisms. The process is not about finding a correct interpretation, but about facilitating the client's own understanding and meaning-making, promoting self-awareness and emotional processing. Therapeutic techniques. Painting. Painting offers a rich and fluid medium for emotional expression in art therapy, allowing for a wide range of colors, textures, and movements. The act of applying paint to a surface can be deeply cathartic, facilitating the release of intense emotions that might be difficult to verbalize. Techniques include free painting, where clients explore colors and forms without specific direction, and guided painting, using prompts such as "paint your anger" or "paint your hopes." The fluidity of paint can encourage spontaneity and a willingness to embrace ambiguity, mirroring life's uncertainties. This medium is particularly effective for clients who need to express strong feelings or explore complex emotional landscapes. Watercolors and acrylics are two popular painting media in art therapy, each with distinct qualities. Watercolors, known for their transparency and delicate washes, can represent subtlety, vulnerability, and the blending of emotions. Their unpredictable nature can also help clients practice letting go of control and embracing imperfection. Acrylics, on the other hand, are opaque, versatile, and dry quickly, allowing for layering, bold statements, and the ability to easily modify or cover previous work. This can be empowering for clients who wish to make strong declarations or experiment with different emotional states. Both mediums offer unique pathways for self-discovery and emotional processing, with the therapist guiding the client to explore the meanings behind their choices and creations. Therapeutic techniques. Sculpture and clay, or working with clay, offer a powerful tactile and three-dimensional experience in art therapy, engaging clients in a unique way. The physical act of molding, shaping, and building with clay can be deeply grounding and meditative, helping clients to connect with their bodies and regulate emotions. It provides a tangible way to externalize internal feelings, allowing clients to literally give form to their thoughts, anxieties, or hopes. This medium is particularly effective for clients who struggle with body image issues, trauma, or those who benefit from a more kinesthetic approach to therapy. The resistance and malleability of clay can also mirror personal challenges and the capacity for change. Clay, in particular, is a highly versatile and forgiving medium, making it ideal for therapeutic exploration. Its malleability allows for continuous revision and transformation, symbolizing the client's ability to reshape their experiences and perspectives. Clients can explore themes of containment, destruction, and reconstruction through the process of working with clay. Creating three-dimensional forms can also help clients develop a stronger sense of self and boundaries, as they literally define space and volume. The finished sculpture can then be explored for its symbolic meaning, offering insights into the client's inner world and their relationship with their environment. This hands-on process fosters a sense of accomplishment and empowerment. Therapeutic techniques. Collage and mixed media. Collage and mixed media techniques offer unique avenues for therapeutic exploration, allowing clients to combine diverse materials to create rich, multi-layered artworks. Collage involves assembling various images, textures, and objects onto a surface, providing a non-threatening way to express complex ideas and emotions. It can be particularly helpful for clients who feel overwhelmed by a blank page or struggle with drawing skills, as it allows for immediate creation and symbolic representation. The act of selecting, cutting, and arranging pieces can be a meditative process, fostering decision-making and integration. This technique encourages clients to explore fragmentation and wholeness, creating new narratives from disparate elements. Mixed media expands on collage by incorporating a wider range of materials, such as paint, pastels, fabric, natural objects, and found items into a single artwork. This approach encourages experimentation and flexibility, allowing clients to break free from traditional art constraints and explore new forms of expression. The layering of different materials can represent the complexity of emotions, experiences, and identities. Mixed media is excellent for clients exploring themes of identity, integration, or those who need a more sensory-rich experience. The process of combining disparate elements into a cohesive whole can be deeply symbolic of integrating various aspects of oneself, fostering a sense of completeness and personal narrative. Therapeutic techniques. Digital art. Digital art therapy utilizes technology and digital tools to facilitate creative expression and therapeutic processing. This modern approach offers unique advantages, such as undo-redo functions that reduce performance anxiety and encourage experimentation, appealing to clients who may be intimidated by traditional art materials. Digital platforms provide a vast array of colors, brushes, and effects, expanding creative possibilities. Techniques include digital painting, photo manipulation, and creating animated sequences. It can be particularly engaging for tech-savvy clients, adolescents, or those with physical limitations that make traditional art making challenging. Digital art offers a contemporary and accessible pathway to self-expression and therapeutic insight. While digital art therapy offers numerous benefits, it also presents unique challenges and considerations. Therapists must ensure clients have appropriate access to technology and possess basic digital literacy. The ephemeral nature of digital files and the potential for distraction from screens require careful management. However, the ability to easily share and print digital artwork can be empowering, allowing clients to disseminate their creations in new ways. The therapist's role involves guiding clients through digital tools, helping them explore the therapeutic implications of their digital creations, and ensuring that the focus remains on the process and meaning-making, rather than solely on the technical aspects or aesthetic outcome. It is a growing area within art therapy, continually adapting to technological advancements. Working with children and adolescents. Art therapy is particularly effective with children and adolescents, as art making is a natural and developmentally appropriate form of communication for them. Children often lack the verbal skills to articulate complex emotions or traumatic experiences, making art a vital outlet for expression. Art therapy provides a safe, non-threatening space for them to explore feelings, process difficult events, and develop coping strategies. Techniques are adapted to their developmental stage using age-appropriate materials and directives. For instance, younger children might engage in free play with clay or finger paints, while adolescents might explore identity through collage or digital art. The focus is on fostering resilience, self-esteem, and healthy emotional development. Common interventions for children and adolescents in art therapy include creating feeling faces to identify and express emotions, drawing safe places to build a sense of security, and using puppets or masks to explore different roles and identities. For adolescents, art can be a powerful tool for navigating identity formation, peer relationships, and future aspirations. Group art therapy can also be beneficial, allowing them to develop social skills and connect with peers through shared creative experiences. Therapists must be attuned to developmental milestones and tailor their approach to meet the unique needs of each age group, fostering a supportive and engaging therapeutic environment. The goal is to help them gain insight and develop healthier coping mechanisms. Working with adults. Art therapy offers profound benefits for adults, providing a powerful means to address complex life challenges, emotional distress, and personal growth. Many adults find verbal therapy challenging, especially when dealing with deeply rooted trauma or emotions that are difficult to articulate. Art provides a non-threatening, symbolic language to explore these issues, offering a safe distance for processing. It helps adults gain insight into their patterns of thinking and behavior, develop new coping mechanisms, and enhance self-awareness. The creative process can also be a source of stress reduction and mindfulness, promoting overall well-being. It empowers individuals to take an active role in their healing journey. For adults, art therapy can be instrumental in addressing a wide range of issues, including trauma, grief, anxiety, depression, and relationship difficulties. Techniques might involve creating mandalas, the self-centering, drawing timelines to process life events, or sculpting figures to represent internal conflicts. Art can facilitate the processing of traumatic memories by externalizing them in a contained way, allowing for gradual integration. In cases of grief, art provides a space to honor losses and express complex emotions. It also promotes self-discovery, helping adults explore their identity, values, and life purpose, fostering a deeper connection to their authentic selves and building resilience for future challenges. Working with older adults, art therapy offers significant benefits for older adults, addressing unique challenges associated with aging, such as cognitive decline, social isolation, grief, and physical limitations. Engaging in creative activities can stimulate cognitive function, improve fine motor skills, and provide a sense of accomplishment and purpose. It offers a non-verbal outlet for expressing emotions and memories, particularly for those with communication difficulties or dementia. The process of art making can reduce anxiety and depression, fostering a sense of well-being and connection. It provides a valuable opportunity for self-expression and maintaining a sense of identity in later life, enhancing overall quality of life. Interventions for older adults often focus on cognitive and emotional support, as well as life review. Art activities might include creating memory boxes or collages that reflect life experiences, drawing mandalas for relaxation, or engaging in simple painting exercises to stimulate creativity. For individuals experiencing cognitive decline, art can provide a meaningful way to engage, maintain connections, and express themselves, even when verbal communication is limited. Life review through art allows older adults to reflect on their past, process unresolved issues, and find meaning in their life journey. Group art therapy can also combat social isolation, fostering connection and shared creative experiences among peers, promoting a sense of community and belonging. Art therapy in group settings. Art therapy in group settings leverages the power of shared creative experience to foster connection, communication, and mutual support among participants. Groups can be structured around specific themes, populations, or therapeutic goals, providing a safe space for individuals to explore their issues alongside others. The group dynamic itself becomes a therapeutic tool, offering opportunities for social learning, empathy, and feedback. Participants can witness different perspectives, practice new interpersonal skills, and realize they are not alone in their struggles. The shared act of art making can reduce feelings of isolation and build a sense of community, enhancing the overall therapeutic impact. It provides a unique blend of individual expression and collective experience. Facilitating group art therapy requires specific skills in managing group dynamics and tailoring interventions to suit collective and individual needs. The therapist guides the group through art activities, encouraging both individual expression and interaction among members. Discussion of the artwork is crucial, allowing participants to share their process, interpretations, and reactions. This can lead to profound insights, as members offer support, challenge perspectives, and identify common themes. The therapist also manages potential conflicts, ensures a safe and respectful environment, and helps the group process their shared experiences. Group art therapy is particularly effective for developing social skills, improving communication, and fostering a sense of belonging, making it a powerful modality for diverse populations. Art therapy for trauma survivors. Art therapy is an invaluable modality for trauma survivors, offering a non-verbal, non-threatening pathway to process and integrate traumatic experiences. Trauma often overwhelms verbal capacities, making it difficult to articulate the depth of suffering. Art provides a safe distance, allowing survivors to externalize their experiences symbolically without having to explicitly recount distressing details. This can reduce the risk of re-traumatization and help clients regain a sense of control. The creative process itself can be grounding and regulating, helping to manage overwhelming emotions and physiological responses associated with trauma. It empowers survivors to tell their story in a way that feels safe and manageable. Key aspects of art therapy for trauma survivors include establishing safety and containment, processing traumatic memories, and fostering post-traumatic growth. Therapists prioritize creating a secure environment where clients feel safe to explore. Art activities are often structured to provide containment, such as creating containers for difficult emotions or using specific boundaries in artwork. Gradually, clients can use art to process fragmented memories, integrate dissociated parts of self, and reconstruct a coherent narrative. The focus is not only on healing past wounds, but also on building resilience, developing new coping skills, and discovering inner strengths. Art can help survivors move from a place of helplessness to one of empowerment, fostering a sense of hope and renewed purpose. Art therapy for mental health conditions. Art therapy is an effective complementary treatment for a wide range of mental health conditions, providing a non-pharmacological approach to managing symptoms and promoting recovery. For individuals experiencing depression, art can combat apathy and provide a sense of accomplishment, while offering an outlet for expressing sadness and despair. For anxiety, the creative process can be grounding and meditative, reducing physiological arousal and fostering a sense of calm. Art therapy helps clients externalize their internal struggles, gain insight into their conditions, and develop healthier coping mechanisms. It empowers individuals to actively participate in their mental health journey, fostering self-efficacy and hope. Specific applications of art therapy extend to conditions like eating disorders and addiction, where it addresses underlying emotional and psychological factors. In eating disorders, art can help clients explore body image issues, control, and self-worth in a safe, symbolic way. It provides a means to express feelings that might be suppressed or distorted, fostering a healthier relationship with their body and self. For addiction, art therapy supports recovery by helping individuals identify triggers, process cravings, and explore alternative coping strategies. It can also facilitate emotional expression and self-discovery, addressing the root causes of addictive behaviors. The creative process offers a constructive alternative to destructive patterns, promoting self-awareness and sustained recovery. Art therapy in medical settings. Art therapy plays a vital role in medical settings, providing holistic support to patients coping with physical illness, chronic pain, and medical treatments. It offers a creative outlet for expressing the emotional impact of illness, which can include fear, anger, grief, and anxiety. Engaging in art can distract from pain and discomfort, promoting relaxation and reducing stress. For patients facing long hospital stays or difficult diagnoses, art therapy can foster a sense of control, purpose, and normalcy. It helps individuals process their experiences, adapt to changes in their health, and maintain a sense of identity beyond their medical condition. This approach acknowledges the profound connection between physical and emotional well-being. Interventions in medical art therapy are tailored to the patient's physical condition and emotional needs. For patients experiencing chronic pain, art can provide a non-verbal way to express the intensity and location of their pain, helping them to externalize and manage it. Creating visual narratives around their illness can help patients process their journey, grieve losses, and find meaning. Art can also be used to prepare for medical procedures, reduce anxiety, and promote positive visualization. In pediatric hospitals, art therapy helps children cope with illness and hospitalization, providing a sense of play and normalcy. The goal is to enhance coping skills, improve emotional well-being, and support the patient's overall healing process. Recognizing the therapeutic power of creative engagement in challenging circumstances. Ethics in art therapy practice. Ethical practice is paramount in art therapy, guiding therapists to uphold the highest standards of care, respect client autonomy, and ensure client well-being. Core ethical principles include beneficence, doing good, non-maleficence, doing no harm, fidelity, being trustworthy, justice, fairness, and autonomy, respecting client choices. Art therapists must navigate complex situations with integrity, always prioritizing the client's best interests. This involves maintaining professional boundaries, ensuring competence, and continuously engaging in self-reflection and ethical decision-making. Adherence to ethical guidelines protects clients, maintains the integrity of the profession, and fosters trust in the therapeutic relationship. It is a continuous process of learning and applying moral principles. Key ethical considerations in art therapy include confidentiality, informed consent, and professional boundaries. Confidentiality is crucial, ensuring that client information and artwork are protected, with clear limits explained to the client. Informed consent involves fully explaining the therapeutic process, potential risks and benefits, and client rights, ensuring voluntary participation. This is particularly important when working with minors or vulnerable populations. Maintaining professional boundaries is essential to prevent dual relationships and ensure the therapeutic relationship remains focused on the client's needs. Art therapists must also consider cultural competence, avoiding imposing their own values and respecting the diverse backgrounds of their clients. Ongoing supervision and consultation are vital for navigating ethical dilemmas and ensuring responsible practice. Upholding the integrity of the profession and safeguarding client welfare. Cultural competence in art therapy. Cultural competence in art therapy is essential for providing effective and respectful care to clients from diverse backgrounds. It involves understanding and appreciating the client's cultural context, including their beliefs, values, traditions, and experiences, and how these influence their perception of art and therapy. Therapists must recognize their own cultural biases and assumptions to avoid imposing them on clients. This approach moves beyond mere awareness, requiring active engagement in learning about different cultures and adapting therapeutic interventions accordingly. Culturally competent practice fosters trust, strengthens the therapeutic alliance, and ensures that art therapy is relevant and meaningful for each individual. It is a continuous process of self-reflection and learning. Implementing culturally sensitive practice involves several key strategies. Therapists should research and understand the cultural significance of symbols, colors, and art-making traditions relevant to their clients' backgrounds, recognizing that meanings can vary widely. They must also be mindful of communication styles, both verbal and nonverbal, and adapt their approach to facilitate comfortable expression. It is crucial to invite clients to share their cultural perspectives on their artwork, rather than assuming universal interpretations. Building rapport through genuine curiosity and respect for cultural differences is paramount. This approach ensures that art therapy is not only effective, but also empowering, validating the client's unique cultural identity and promoting healing within their specific cultural framework. It is about creating an inclusive and equitable therapeutic space for all. Professional identity and self-care. Developing a strong professional identity is crucial for art therapists, encompassing their unique role, responsibilities, and ethical commitments within the mental health field. This involves understanding the scope of practice, adhering to professional standards, and continuously engaging in professional development. A clear professional identity helps therapists advocate for their clients and the profession, navigate interdisciplinary teams, and maintain confidence in their therapeutic approach. It is built through education, supervision, and practical experience, solidifying their expertise and unique contribution to healing. This ongoing process ensures therapists remain effective and respected practitioners, contributing to the growth and recognition of art therapy. Self-care is not merely a luxury, but an ethical imperative for art therapists, essential for preventing burnout and maintaining professional effectiveness. Working with clients' emotional pain and trauma can be emotionally taxing, making it vital for therapists to engage in practices that replenish their physical, mental, and emotional resources. This includes activities such as personal art making, mindfulness, regular exercise, maintaining a healthy work-life balance, and seeking personal therapy or supervision when needed. Prioritizing self-care ensures therapists can remain present, empathetic, and resilient in their work, preventing compassion fatigue and promoting long-term professional sustainability. It is a commitment to their own well-being that directly impacts the quality of care they provide to clients. Supervision and consultation. Supervision is a cornerstone of professional art therapy practice, providing a structured and supportive relationship where therapists can reflect on their clinical work, enhance their skills, and ensure ethical conduct. It involves regular meetings with an experienced art therapist supervisor who offers guidance, feedback, and challenges the supervisee to grow. Supervision helps therapists process countertransference, navigate complex client dynamics, and develop their theoretical understanding. It is crucial for maintaining professional competence, preventing burnout, and ensuring the highest quality of care for clients. This ongoing professional development is a requirement for licensure and ethical practice, fostering continuous learning and accountability. Consultation, while distinct from formal supervision, also plays a vital role in professional development and ethical practice. It involves seeking advice or guidance from peers or other specialists on specific cases or professional challenges. Consultation can be less formal than supervision, but offers valuable external perspectives, helping therapists troubleshoot difficult situations, explore alternative interventions, and gain new insights. Peer consultation groups provide a supportive network for sharing experiences, reducing isolation, and fostering a sense of community among practitioners. Both supervision and consultation contribute significantly to a therapist's growth, ensuring they remain informed, reflective, and capable of providing effective and ethical art therapy services. They are essential for navigating the complexities of clinical work and maintaining professional excellence. Research and evidence-based practice. Research and evidence-based practice, EBP, are vital for the continued growth and credibility of art therapy as a recognized mental health profession. EBP involves integrating the best available research evidence with clinical expertise and client values to make informed treatment decisions. Art therapists engage in research to evaluate the effectiveness of their interventions, understand underlying mechanisms of change, and identify best practices for diverse populations. This commitment to empirical inquiry strengthens the theoretical foundations of art therapy and demonstrates its efficacy to the broader scientific and healthcare communities. It ensures that art therapy interventions are not only intuitively helpful, but also demonstrably effective, contributing to improved client outcomes. Contributing to the field through research involves various methodologies, from qualitative studies exploring client experiences to quantitative studies measuring specific outcomes. Art therapists conduct studies on the impact of art therapy on conditions like trauma, anxiety, depression, and chronic illness, using standardized assessment tools and rigorous research designs, disseminating research findings through publications, presentations, and conferences is crucial for advancing knowledge and informing practice. By actively engaging in research, art therapists contribute to a growing body of evidence that supports the therapeutic power of art. This commitment to EBP not only enhances the profession's reputation, but also ensures that clients receive the most effective and ethical care available, fostering continuous improvement and innovation within the field. Setting up an art therapy practice. Establishing a private art therapy practice involves navigating both clinical and business aspects to ensure sustainability and effective service delivery. This includes developing a comprehensive business plan, securing appropriate office space, and managing financial considerations such as budgeting, billing, and insurance. Therapists must also consider legal and regulatory requirements, including licensure, privacy laws, example, HIPAA, and professional liability insurance. Building a successful practice requires a clear vision, strong organizational skills, and a commitment to ethical business practices. It is a significant step for art therapists seeking autonomy and the ability to shape their unique therapeutic environment, allowing them to serve their community effectively. Marketing and referrals are crucial for building a client base and sustaining an art therapy practice. Developing a professional website, utilizing social media, and creating informative brochures can help reach potential clients. Networking with other healthcare professionals, schools, and community organizations is essential for generating referrals. Therapists should clearly articulate their unique approach, target population, and areas of specialization to attract clients who are a good fit for their services. Building a strong professional reputation through ethical practice and positive client outcomes is paramount. Continuous engagement with the community and ongoing professional development also contribute to the long-term success and growth of a private practice, ensuring a steady stream of clients and a fulfilling professional journey.